Good evening, and thanks for joining us for this live edition of Being Well. I'm one of your hosts tonight, Keanne Armstrong, and this is our other host and the new host of Being Well.
Good evening, everyone. I'm Lacey Spence. I'm so excited to be taking over such an informative and helpful show. Now to get to our topic of the evening, coronavirus and mental health.
That's right. With the global pandemic, it's been a stressful year for everyone, to say the least.
So we'll be diving into the issues we've all been facing and healthy ways to cope with our panel of experts coming up next, so stay tuned.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
Welcome back. Before we dig into tonight's topic, we'd like to introduce our panel of experts. First is Dr. Marilyn Frey. She's one of the longest practicing clinical psychologists in Illinois with over 50 years experience. She's a full-time professor at Capella University, as well as being affiliated with Horizon Health in Paris for over 20 years.
We also welcome to the show Terri Johnson, BA, CADC, Outpatient Coordinator, and Danessa Carter, PhD, LCPC, Substance Use Disorder Counselor, both with the Our House here in Charleston. Thank you all for joining us tonight.
Thank you.
So as we start this evening, one of the biggest things we'd like to hit is normalizing what we're all feeling, and it varies from person to person. So we'll start with you, Dr. Frey. What does it mean to you to normalize feelings?
Well, first of all, we need to look at that people, unfortunately, still do not look at mental health in the same way as physical health. And sadly, when they're feeling normal depression or anxiety, and I emphasize the word normal at this point, they hide it because for some reason they think there's something wrong with them. Sadly, and reality is that with what we're all going through now, there are far more emotions that we're experiencing, and how could we not? And I really want to emphasize, how could we not feel depression, anxiety, fear, anger, and even aggression? And so one of the most important things for me is helping people to understand it's okay. There is nothing wrong with you for having these feelings. If you didn't, I would question denial, okay? So I want people to understand that these are very difficult times. But I also want you to hear that research has shown that a lot of us have something called a resilience gene, and we're actually going to be able to do this, okay?
Mm-hmm. Terri or Danessa, are you seeing any of that in your line of work as well, just trying to put people at ease that it's okay to feel what you're feeling?
Yeah, I think one of the things that is different in this circumstance than maybe other circumstances that we've had is this is something we're all going through together. Mm-hmm. That even if you're in the helping profession, if you're in a position of authority, like as a teacher, a service worker, like police officers, ambulance workers, all of us are dealing with a crisis as well as trying to continue to do our jobs and help others, which I think complicates things even further. And that's a unique situation that I don't think has occurred that I can recall in our history, where everybody seems to be going through something so critical and devastating.
And then as a helper to be able to distance yourself from your own stuff, I just think of whether it's, you've got maybe even just short-staffed. We went to telehealth, and so now we're having to learn to do our jobs completely different to serve our clients in the best way and to help them with their adjustments as we're adjusting on the fly as well.
That's right. I think it's hard to learn how to juggle something that you've never dealt with before. None of us have dealt with this before. And so we're all questioning, are we doing things the right way? Are we supposed to be doing something different? And learning to talk to each other and understand each other's situation along the way as well is difficult too.
You bring up a really good point, okay, which is being able to talk to each other. This is critical, that you don't self-isolate, even if you're physically isolating yourself. One of the things that I do with my patients is that I actually will have them make a little bit of a list as to people that they're going to talk to. And interesting enough, not just close friends or family, but I like to have people think of someone who might be more shy and inhibited and embarrassed and put them on this little list. And I'm a big list person, okay?
We like that around here.
Yeah, a big list person. And have people actually look at how many times a week did I talk to them. And I mean in a healthy way, not in a negative way, because one of the other things we have to watch right now is that when we're all so overwhelmed, it's very easy to get into negativity, okay? So that was a very good point you brought up.
Thank you. Thank you for expanding upon that as well. Would either of you like to add on to that as well?
I think isolation is something that's just it's absolutely devastating for people with a range of mental health issues, including addiction. I actually had a client say to me that it felt like she was using substances again, that all of her behaviors during lockdown were very similar to what it had been when she was in active addiction. So she wasn't going out of her house as much, she wasn't talking to people. All of the normal things that she was doing previously, like going to self-help meetings or in-person groups, were no longer happening. So changing the way and being more intentional in how you reach out to people and looking for alternative methods of connecting with others.
Yeah, and I think what that helps them, each of us, to build is resilience to it. But without that reaching out, without, like Dr. Frey said, talking about it, it is so critical. And it's sometimes the last things we want to do, because like you said, it's only me, no one else is feeling this way. And we all do that. And so encouraging others to talk about it, reach out, and recognize where we're being brave.
And I like that idea of having a list that you refer to help hold yourself accountable. It's easy to get caught up in the everyday things and not think about that I need to reach out and actually discuss about how I'm feeling.
If I could take the list idea further,
Yeah.
okay? As I said, I'm a major list maker. And I actually have patients initially check in with me on the list. So not only would it be how many people you reach out to and have their names and how many times you contact them, but what else can you put on the list that's a goodie for you, but also healthy? Like, for instance, getting in your car alone still keeps you isolated, and drive around the lake or drive around the square, or here in Charleston, drive around the campus, okay? So that it's important that when you're feeling overwhelmed and tend to go into apathy, lethargia, more deep depression, if you can make a list, it will help you. I want to, if I may, take it to physical health. I have a lot of training in the relationship between mental health and physical health, and I was very fortunate. And one of the reasons I tried to use a affirmative, make sure they're doing something, is so that their body doesn't shut down and there's a higher probability of developing certain physical problems or exacerbating certain physical problems you have. And without getting specific, because that's pretty intense, this is critical because I'm definitely seeing more of that now.
And we've got, some fabulous folks here from the Our House. What's some advice that you would give to people who might normally turn to negative vices, where Dr. Frey is saying, get out and enjoy the outdoors, or maybe a healthy snack, something like that to treat yourself? What kind of triggers do you think people are facing?
Oh, it's from the isolation, just feeling isolated can be a trigger, losing employment, that sense of hopelessness that can come with that, but often the lack of connection is where we see it the most. Like Danessa referred to, not being able to go to in-person self-help meetings that they're maybe very used to and involved in, and seeing people. And so really encouraging them to continue to reach out. There are online self-help meetings, doing those, and that can be very intimidating at first. Checking in with us when and if needed, often. And we have people that regularly do that, even if they're not in services. They just check in if they're a former client. So that connection piece, I think, is critical, because with connection comes accountability. And so being able to name their trigger and hold themselves accountable to those people in their life that help them with recovery.
One of the saddest things, I think, is that after lockdown, when things started to reopen, some of the first things that started to reopen were bars and casinos, right? So these really big trigger points for people, that I'm not able to go to an in-person self-help meeting. I'm unsure of how to navigate online self-help meetings. Maybe I'm not technologically savvy, or I don't have access to the resources like a lot of people in our rural community do. And then instead, now the only things that are back are these old ways of coping that I had. And also, less people are watching me. Less people are checking in. Less people would notice if I was using a substance again, or if I was using any sort of unhealthy coping skill again. So I think that the resources are out there still. Like we talked about, online self-help meetings. Most agencies haven't closed. They're just doing services differently than they've done before. And so you have to work harder a little bit. You have to work differently, but you can find some creative solutions out there to get your needs met. And I think a lot of the healing communities have really kind of risen to the occasion in helping people get access to those services that they need.
I think what you said a little bit ago about the client that you work with that did some self-checking, keeping herself in check and talking to you about it, and then making the lists and finding ways to empower yourself and find the value in doing different things, different ways. And if you are looking for resources, we've got some different hotline numbers, some different numbers that you can call. One of them is the Our House that we'll be putting on screen from time to time throughout this show. But we talked before the show about how important it is to empower yourself.
This is so important, and to make a game out of it, of, hey, I'm pretty proud of myself here. Look that I kind of survived this, and I'm doing great, and I've learned new skills. Another thing that I'm finding people are doing, and I have to laugh at this, is they're taking up hobbies or doing things that they never had time for. Like, I am hearing of people who are knitting and sewing and cooking versus using frozen food. And if you think about it, that's a luxury. That when you're working full-time, when you're running children to sports events, or you're going to different things that you have to be at, you don't have that luxury. So a lot of this, to me, is helping people to develop I'm empowered, I can handle this, and literally make a game out of it with the reward system, as long as it's not an unhealthy reward system. I always worry about that. Okay, we don't need to see more addiction, we don't need to see more people eating too much unhealthy food, but we could really look at empowering yourself.
It's okay to celebrate the little things, whether it's I
goodness.
got up and got myself ready today, or I got the kids a hot breakfast. With what you two are dealing with, do you guys have any other little check marks that people can kind of pat themselves on the back about?
I think for me, one is just like learning how to incorporate what worked for you before in this new world. So if you really enjoyed going to self-help meetings, well, now one of the cool things about self-help meetings online is they're happening 24 hours a day. So you can access it anytime, any place, anywhere, rather than, and you can sometimes work that more conveniently in your schedule. So if I'm having a difficult lunch hour, like my work day was horrible, so for lunch, my lunch hour, I'm going to eat and go to this meeting, or I'm going to call my counselor on my lunch break, and so be more intentional about my time and when I'm struggling with things. And I also believe that looking into those hobbies is great too. That's one of the things that I always encourage people in recovery to do anyway. A lot of people, when they first get clean or first come out of depression, have no idea what their interests are anymore or what they want to do. So changing that from, oh my goodness, I don't even know who I am, to I have an opportunity to try new things and to figure out what I like and what I don't. And a lot of the hobbies that you've talked about and that I've also seen people doing aren't necessarily high cost. I mean, like right now, it's you're not going places and traveling and doing things that are more high cost items. So trying some things that are also economical too.
Yeah. I do think, and I need to say this, so those that are struggling making use of the resource numbers, we're kind of coming at this with the assumption that people have their basic needs met. And there are a number of people in our community that are struggling with housing, they're struggling with food, they're struggling with those things. And so I just can't stress enough to make that phone call, utilize the resources that are available. There are many resources in this community available, and to use them, because until basic needs are met, there's going to be no hobbies happening. There's going to be no lists being made because of the overwhelming fear and depression and anxiety and hopelessness that can come with that. And so I can't encourage enough to reach out and get those resources.
To go off of that, there's social service programs that exist for a reason, right? Like if you have worked your whole life and now find yourself unemployed because maybe your field doesn't even exist anymore because of concerts shutting down, for instance, if you worked at a concert venue or a ballpark and now that doesn't exist, well, try to alleviate and normalize those feelings of guilt and sadness and even depression about having to get unemployment. That is nothing to feel ashamed about. You paid into that resource already by being employed, so utilize the benefit that exists there now.
And that leads into our first break really nicely, so we will go to that really quick and we will be right back with more great information.
I had negative $170-something in my bank account.
For more than 4 months, Daniel Vogt waited for unemployment after losing his bartending job in Washington, D.C. Last week, a debit card finally arrived, loaded with thousands of dollars in unemployment back pay.
When you look at that card, what do you think?
I'm just really apathetic about this country. I've seen it have a lot of opportunities to do the right thing and take the other option every time.
The damage is already done. He maxed out his credit card and says he got evicted by his roommates after he couldn't make rent. Now he's living with his dad in the Bronx.
If they had given me the money earlier, it wouldn't have been this big of a problem, and the amount of money they gave me would have been fine. But now I have all these compounded problems.
The safety net failed vote, and he's not alone. The pandemic has cost the U.S. nearly 13 million jobs, leaving Americans to face a system ill-equipped to handle the surge. The consequences are real. Without more government aid, up to 40 million Americans face eviction by the end of the year.
Nobody pays attention to unemployment insurance when the unemployment rate is 3 or 4%. So some states just sort of ignored their system since the last recession to make it harder for people to get benefits.
Like Leah Arrington. She applied for unemployment and pandemic unemployment assistance, but after months of waiting, she says the Georgia Department of Labor denied her both because she was terminated from her job last September due to attendance. She was the medical proxy for her terminally ill sister and had to make the decision to end her life. Her grief made it hard to get out of bed.
Each person's particular circumstances needs to be individually heard. Ultimately, I was not at fault for my sister dying, and it caused me total financial chaos.
She says she's $15,000 in debt and hasn't been able to make rent in months. She sends her 15-year-old daughter to friends' homes to get 3 full meals a day. Arrington says she applies for jobs every day, but with millions of other Americans looking, it's been an uphill battle.
I haven't had any offers, so pretty much just still continue to search and look and put my best foot forward.
Out of options, Arrington says she's appealing her unemployment decision. This appeal is her last hope.
I still have no relief on any of my financial situations. Seem to be getting worse, but I'm remaining hopeful.
And we're back, and we are going to talk about guilt now. There's all kinds of variety types of guilt that we're all facing these days, dealing with. It could be financial guilt. It could be guilt, I'm working, I need to be home with my child. It could be guilt, I need to be at work. All kinds of different things. So let's switch a little bit of gears here and talk about all the different types of guilt that we're dealing with and how best to deal with it. Dr. Frey, would you like to start out?
That's a very big topic. Okay, an extremely big topic.
And very heavy.
When I think about it, you can feel guilty for something that you have no control over. And I'm going to take having children. I think as parents, we want to provide the best for our children. And even though we're powerless at this point, it still doesn't make us feel not guilty for them having the same experiences of being with their peers. So I think that's one kind of guilt, but I also think there's another type of guilt that I know we discussed, which is, what if you're not suffering as much as other people? And I think that's something to look at. Everybody's not suffering the same way. We're all experiencing change and difference, but the two of you said something about the economics of this. And I think this is really important for people who are not being affected financially to remember that their worldview right now is not everybody's worldview. And to think of what you could do for others. This is, in my opinion, the time when we have to be, we always should be socially responsible. I'll be very blunt about it. But when we really have to be socially responsible and look at basics, Like, there's a few programs in my community that I'll be very clear, I had never heard of, okay? And when I heard of them, I have to say, in a couple cases, I was shocked that people could go weekends without food, meaning children. And so for those of us who are not experiencing some of the issues, we're all experiencing issues, I think that this is not the time to put your head in the sand. And I use that expression a lot, to the point where people wish to be blunt that I'd shut up, okay? But I think that that's something that we need to look at. Another point, if I just might add, and someone brought this up to me, is in couples or in families, sometimes you have one person who is working from home, and they're to doing all the taking care of the children and the homeschooling, and the partner, the one who is going into work, is experiencing some guilt that it's not fair that, say, their husband is going through this, even though he may enjoy it or may not enjoy it. So I think that there's all sorts of guilt to look at.
And maybe if I'm somebody who doesn't struggle with sobriety, I might be feeling guilty for my counterparts who are. What are some good ways that I can check on them or reach out to them to make sure that if I'm not in as bad a place, that I can help bring them out of it?
Right.
Yeah, for sure. I think that's a really good opportunity for people who maybe don't struggle with something. Or I was even thinking, if you financially aren't very secure, but you have time on your hands, getting out of yourself and giving back to others is such a good way to overall just improve mood. You know, it feels really good to volunteer and to do something to help somebody else out. By no means do you have to be able to diagnose someone to say, I'm concerned about you and I'd like to reach out and see how you're doing. If you have a family member that you've always kind of worried about, or a friend that you've noticed that they have some problematic behaviors, but it's never really been addressed, you don't even have to address those directly. Just calling, picking up the phone, texting someone and saying, how are you doing? This is really hard, so I just wanted to see how things were going there.
And I think even in the practical, as you're describing, you know, picking up a sub and saying, I'm going to take you to the park, and where you can be outside and sit 6 feet apart, and still be together, but separate. But you know, what we're talking about is going back to that connection, and even on the guilt, when you were sharing about the partners, I think there's been a certain amount of worry for people that are going to work, especially. I think it's gearing back up of, what if I bring something home to my family? What if I'm exposing my family or my loved ones to something because I am going out and working my job? And so I think it's, you know, all sorts of guilt. I'm doing better, or I'm bringing something home, or I'm worried about somebody else and I don't know how to help them, so I feel guilty that I'm not doing enough. And so, as we both have said, just getting outside of ourselves and doing something, whether it's a phone call or...
And you have to remember to balance that I can't have any sort of negative feelings about what's going on because somebody has it worse than me. Somebody's always going to have it worse than you. That doesn't mean your feelings aren't valid, versus the grass is always greener. Like, look at them, look what they have. Like in the example of a stay at home, like I'm working from home, taking care of the child versus I'm out there, they both have pros and cons. They both have difficulties, fears, guilts, all of the above. It isn't necessary that we need to like rank everything, but instead realize that it's apples and oranges. They're different and both challenging.
So what would you suggest outside of going outside and finding something different to do with your time? I mean, I think it's really important. Don't shame yourself. Don't shame others. But what are some other things besides going outside and taking a drive or just trying to reflect on something else? Give us some other ideas on some different things, because I think guilt is a real big one to deal with right now, along all the different struggles that people are having in all the different situations.
One of the things that I've noticed throughout my counseling career is that your internal thoughts have so much more power when they stay internal. So figuring out a way to get them external, whether it's talking to a therapist, whether it's talking to your primary care physician when you don't know how to access a therapist, whether it's texting a friend or calling a family member, or even journaling. If these are things that you're too scared to say out loud to someone currently, finding a way to just get that outside of your body, even through writing. Or, I know this is gonna sound insane, and anytime I suggest it, my clients are like, what are you talking about? Talking to yourself in a mirror.
Yep.
Hearing the words out loud make them have such a different level of power in your life. And you suddenly have a different clarity about, like, wait a second, like, let me challenge what I'm thinking here. Let me challenge this belief.
And I think recognizing when that guilt, that self-talk, what you're talking about, getting that word dump out, whether it's verbally in the mirror, on paper, but has that gone from guilt to shame? And I think that's very, very critical, because if it's gone to shame, then it's in a whole different world, and maybe additional resources and someone to help you get back to the truth of, no, I'm not a bad person because I choose to go to work and not stay home, and my poor husband at home with the laundry, the kids, and the this. It's, yep, I'm just feeling bad because I have no ability to participate. Very different thought processes, but being able to recognize what is that internal dialogue and is it destructive?
You both bring up some great ideas. I actually have, and this is very comical, she's about 4 or 5 feet long. Yeah. And it's the most ridiculous looking stuffed doll
nice
you can imagine. And I will have people talk to the doll. Yeah. And then I will have the doll talk back to them. I mean, you should see this doll. Okay. I have definitely lent patients this doll over the years, and it has been so effective to get that absurdity, but it's not absurd because it's what you're feeling out. So that was just a great idea. You also, I had a laugh, you brought up something that I thought, well, that goes on the list that we're talking about, which is, this is the time to automatically reach out to someone and not say, oh, I know you're suffering, or blah, you know, a real negative, but just conversation. Like, did you read this or did you read that, as long as it's healthy stuff versus, you know, some of the crazy stuff. So that was a great idea to put on the list.
Sharing a ridiculous video clip or a funny meme or anything like that. I think reality is very difficult right now, so any kind of little break you can give yourself, and again, balancing that so that your break is a healthy break. So by no means am I, let me tell you, I've seen people do anything in excess and make it unhealthy. Yeah. So you can't just decide, well, I'm going to binge watch a show for 3 weeks and never leave my living room. Like, that takes it to unhealthy. But taking a 30-minute TV break where I don't have to think about anything right now, and I can just watch this show that isn't emotionally triggering to me, isn't difficult, might be a really great mental health break for me.
And you brought up a really important issue, which is, this is where I think a therapist or even a primary physician, a nurse practitioner, whatever, is important that you have the patient check in with you, because there's so much negative now that I am seeing on social media, people escalating to the point, and then others who I know responding to it. So that I think it's important that when we look at what we're doing, that you have someone to check in with, to kind of say, wait a minute, how much negative are you doing? So that's a really good point.
And I think with the guilt too, you had talked about, you know, our physical bodies. Our physical bodies will tell us kind of what's happening. And we haven't talked a lot about anxiety. But with guilt can come a lot of anxiety, that feeling like I can't breathe, or I stop breathing for a minute, and so as they're, as we're journaling or as we're talking, what is the body saying? And a practice I firmly believe in is just sometimes just laying on the floor. You know, just laying on the floor if you're sensing that that's overwhelming physical feeling where whether guilt or depression or something has brought you to just kind of get on the floor, to get grounded, to know that nope, I'm going to be okay. But utilizing those resources too, those different coping skills for anxiety as well.
And Danessa, I really liked what you said about, you know, watching programs or whatever that aren't triggering. That's huge. You mentioned social media. I mean, you almost have to set a time limit on how much time you're watching the news or spend on social media, just because there's so much negative directed at once.
Yeah, it's still pretty overwhelming right now just with new information that's coming out about COVID-19. But initially, March through, I would say even early June, it was crazy. I mean, it was every day we were learning something new, and oh no, that's not accurate. It's actually this thing going on. And it's very easy to go down that rabbit hole and to not know if the information you're even obtaining is of a reliable resource. In that you have to be able to tell yourself and to assess when and some amount of information is too much information and it's time for me to do something else. And the same thing is true with social media. You know, I think that we're so falsely believing that connects us to other people, that simply being able to access their profiles and see what they ate for lunch it means that you know the person. And so then you get caught up in a lot of the negativity. People are willing to post and share things online that they may never be willing to do in person. So not necessarily using that as your parameter for how the world looks.
Right. And one of those things I know I'm going on social media for is all the back to school pictures.
Oh yeah.
So we're going to take a quick break, but our last segment is focusing on kind of our youngest patients, if you will, and that's school-age children. So we'll be right back.
It's easier said than done, but structure during this pandemic is important for everyone, especially children with special needs.
Being thrown out of their routines has really thrown everybody for a loop.
Nicole Hendricks is a psychologist with the Children's Healthcare of Atlanta's Marcus Autism Center. From masks to social distancing, she says knowing what to expect when starting back to school can help.
I know it might seem silly to practice things whenever we're not in that context, but that practice helps us get more familiar and then makes it not so much of a shift in routine when we actually have to do those things out in public.
Finding a mask to match their interests and gradually working up to wearing it longer can also help children to get used to them, says Cheryl Clayman, also of Marcus Autism Center.
Sometimes the fabrics can be scratchy, sometimes they're really soft, sometimes the mask is too big, sometimes it's too tight, sometimes it's pulling the ears forward. So it might take some mask trial and error to find something that's going to work.
And to parents everywhere, they say don't forget to give yourself some grace.
We're not able to accomplish all the things that we want to accomplish. Kids are going to continue to make progress. We will continue to move forward. It's a hard time right now for everyone.
And we're back, and we're going to talk about school-age children and parents and all the different things that are challenging these days with remote learning and trying to figure out what's right, what's wrong, and when we're going to do all of this. So let's open up the topic and talk about parents, school children, and all the different things that are challenging these days. Dr. Frey, would you like to start?
Well, one of the things that I think we're all looking at is both the educational part of our children, but also the developmental issues. And I think this is critical. If you look at various theorists who are widely accepted in the field of child development, clinical counseling, psychology, you'll see that children from the time of birth through actually adulthood go through different developmental stages. And in certain theorists, they need certain relationships at different stages, and this is critical, and they're not getting it. So one of our biggest struggles as a parent is not just the academic, but how to meet the social needs, collegiality, best friend, social group, And these are some of the big challenges. I have ideas, but this is one where I really don't have a lot of answers. I know how I know people are dealing with it, which is seemingly effective. And one of the biggest ways that I'm seeing is that people are picking 1 or 2 families. And they're wearing masks, no doubt about it, but that they are doing some interactions so that their children are not isolated. Okay.
And we've been talking a lot about meeting the basic needs. Danessa and Terri, we kind of talked about it before the show that unfortunately as schools aren't meeting in person, they're kind of missing that first line of defense to catch a lot of issues children are facing.
Right, whether it's, the home life isn't safe because one or both parents are using substances. You're right, teachers have been that first line. Are they going hungry because our schools were feeding our children that were living in poverty and being neglected? And so, yeah, there are a lot of ramifications to not having eyes on. And so really paying attention to those people that are seeking services, that we're paying attention to the kids, and doing family where appropriate, and really checking in on how the kids are doing.
Yeah, as practitioners, I think we all need to be way more intentional about asking about the whole family system. Whereas it may have been felt a little easier to focus on only the client sitting in front of you, or sitting in front of you on the other end of a receiver or the other end of a webcam now, looking around, if they're doing a video conference from their home, looking at that background environment, asking them about how their kiddos are doing and how they feel about how their kiddos are doing, because all of that impacts the whole systemic view of how our clients are doing as well. And I would agree that most of the concerns that I have heard come from parents are about socialization. They're like, okay, the kid can make up what he might be missing in math right now down the road if this isn't something that goes on forever and ever and ever. And let's hope it is not going to be something that continues on forever. But I don't know what's going to happen when this is their kindergarten year, or this is their freshman year, one of those big transitional years, and they aren't having the same interactions with their peers that they used to.
Yeah. What about the anxiety that the children are feeling? What can we do to help them with all of the different things that they're feeling? Because this is affecting the kids just like it is adults and grown-ups and people of all ages, but this is really something completely different than any of us ever experienced as a child.
Yeah.
And since we never went through it, how do we help the children today deal with it? What are some different things that we can tell our viewers to help the children?
One of my favorites are having a lot of sensory experiences for kiddos. So having, I don't know if you guys have ever heard of calm down jars, but you can make them eat really easy with like glitter and water, and a kiddo can shake it up and then use that time to calm down, to just focus on the glitter settling, breathe in and breathe out, having things that they can fidget with in their hands. If they're supposed to be sitting for a Zoom class, that can actually, it looks distracting, but it can actually help kiddos focus more on the online portions of what they're supposed to be learning, making sure that you can give as much feedback as possible to administration and teachers. If your kid is struggling to understand something, if you don't understand how to use the software program or the login information that you've been given, letting somebody know that. Don't try to suffer in silence.
And I think no different than we've talked about for adults is talking with kids, listening, having conversation with kids, and checking in with them. What was the best part of your day? What was the not so best part of your day? Because kids will usually tell us. But we have to ask often. So
we underestimate them all the time. People regularly assume that because they're children that they don't understand what's going on or they aren't being affected by it, when kids are some of the first, they're so perceptive. Like if you've ever been around a kid and you don't want them to hear something, they're automatically like, I heard that, what'd you say?
Yeah.
They will respond to it immediately. So instead, just having open, honest conversations. And the great thing about kids is, you want to talk about that resilience factor, they have it way more than we adults do. So instead of pretending like you have answers that you don't, say, I don't know what's going to happen next. And I know this is really scary. It's scary for me too, but I'm going to be here for you. So rather than shying away from those hard conversations, opening up to them.
Yeah, and be honest
I would
about it.
also really encourage, and the age that I'm focusing on is your preteen, young teen, because of the social issues. And I think as parents, or you need to respect that the children need to talk to each other, meaning other kids. And if it has to be on a Zoom or phone or Adobe, whatever technology you're using, that they need that time alone where you're not listening, okay? Because interesting enough, if you look at the developmental issues, you can really get some of that as long as they have the contact. Now, the kids that I worry about are the ones that are, first of all, special needs, okay? And also the ones that tended to be the shyer one. And that's where I think we have to really work with them. For instance, if I have a friend who has a child who's more outgoing, and my child is the real shy, introverted one, I'm going to reach out and try to get that person to engage that child, because that's where I'm really worried about the damage down the road. And the special needs children. I won't go into different diagnoses, but there are certain diagnoses with children that we really have to look at, that there tends to be a social isolation. And those are the ones that we have to actively, both as parents, as family, as teachers, as church members, really address.
I think it's important to remind kids out there that they still have friends.
Yes.
They're still friends no matter whether they get to see each other every day or not. And you can find ways to check up on each other and still help each other in certain situations and talk to one another. And then if you find out if your friend is struggling, tell somebody, talk to somebody, help find a resource or help for your friend.
I also think giving them some credit for being able to follow some of the guidelines that we have now. I mean, I have a 3-year-old, he'll be 4 in just a couple of weeks actually, and we were pretty isolated for the first few months of COVID. And then when mask wearing became a thing, I had a discussion where if we want to go out, if we want to do things, you have to wear a mask. And he's willing to do that. You know, he understands that this is how we get to do things. So you can have play dates that don't look the same as play dates previously, as long as you can convey that information. We're going to wear masks, we're going to be 6 feet apart, but you can still talk to your kiddo. Me and the other parent will be over here, so you can have some like more private time to discuss things or to interact with one another. And I think we would be pretty surprised about how many kids would be willing to comply with that.
And just making sure that you're reaching out and you're asking, because I think something that I know Kian's dealt with is, you know, she's working and also trying to worry about her child, and there's a lot of parents that are in that same boat. So trying to find the parents that you can connect with who have maybe more free time or things like that, that's just, I wouldn't have even thought of that. I need to find a resource, another person that I can lean on in this time.
I know the homeschool community has always done that, and really leaning in if you've got friends that homeschool. I think back a long time ago, I homeschooled my 3 children, 1st, 2nd, and 3rd grade, and I belong to a community of other homeschoolers. You know, so leaning on those, they've been doing kind of this remote learning thing for a while, and getting some good ideas from them. And like Danessa said, kids are great about mask wearing, and can follow that very readily, I have found. So.
And really there's, kids don't take a whole lot. You know, I know it feels like we take a whole lot, and when talking about guilt and shame, we hold ourselves as parents up to a really high parameter frequently to judge ourselves on. But even giving your kid 30 minutes of undivided attention. On Thursday nights from 6:30 to 7, it's you and me. There's no phones, there's no computers, we're playing, we're gonna do whatever game you wanna play, even if it's the game I absolutely hate because you never wanna play it correctly. I'm very rule driven. And then we're gonna do it. We're gonna do the fun thing that you wanna do. And I mean, even that can make such a big difference in a kiddo's world. And even, I mean, that's a great thing to be implementing even when we're not in the middle of a pandemic, but just being able to kind of turn off the world, you know, to be able to have really, like, I'm not distracted, I'm not cooking dinner, I'm not putting away laundry, I'm not doing the 1,500 other things it feels like we have to get accomplished in a day, and I'm just taking time to be with you.
Yeah, and also helping them feel like they have control over that time.
Yeah.
They get to choose. They get to take control there and turn off the technology. You know, technology is great.
Right.
But it doesn't have to be on all the time. And I think in our world, it's kind of taken us back to a simpler life where we're sitting down and we're playing cards. You know, we're playing board games, we're doing puzzles, we're doing different things because frankly, it does get a little overwhelming to be on technology all the time these days. And you do have to shut it off. And the kids need a break from it. And then if you give the choice to the kids, then they're kind of like, hey, this is what I want to do. Let's try this. And they're coming up and being creative, which is really fun to watch.
And to not compare. It's easy to look on social media and see what such and such mom is doing and appears to have it all together and the hair slicked back perfect and all the kids are, you know, and that's not realistic.
No. Showing the 47 magnet crafts that they've created over the week. Yeah, your social media life is generally not a real life. No. And maybe that's something that they really excel in, but there's something else in parenting that you really excel in. And there's something else that maybe that doesn't work for your kids. And if you had that kind of structure, did those kind of activities, your kid wouldn't thrive with that. So remembering that just because it's happening in some other household doesn't mean it's right for you in your household.
You know, I was also thinking that this could be an opportunity for your children to connect with kids that they wouldn't usually connect with. For instance, I know kids who don't know their neighbors or don't know who lives across the street. And with wearing masks, it is possible to connect with children that you may not have chosen to be with, and even do things like shoot hoops. Or something like that, because you have enough distance, you're wearing a mask, you could be sitting on a porch, okay, like a big wraparound porch, with kids that you ignored or that ignored you. So I think it's another opportunity to address exploring a bigger world, because the technology concerns me. Okay.
A lot of good information tonight. In our last minute, do you have a last word you'd like to throw in? All right. Well, we thank you for tuning in this evening to our live Being Well. It's coronavirus and mental health. And as we said earlier, there's a lot of great numbers. There's a lot of great resources out there. So be sure to take advantage of those.
Absolutely. We hope that you feel educated and informed and empowered. We want you to all stay healthy. We want to thank all of our guests for social distancing tonight with us for this live episode of Being Well. And I want you to join Lacey as she is the new host of Being Well for the new season starting up next week.
That's right. We've got a lot of great topics in store. Some of them are related to COVID. Some aren't. Some are some old reliable ones like heart health and diabetes, things like that. So that will be on Tuesday nights at 7 o'clock. So be sure to join us right here on WEIU TV.
Thank you for joining us.
Thank you.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.